There are many human struggles and medical issues related to a life-threatening illness. The emotional and spiritual struggles of a patient with a short prognosis are often overwhelming. Once associated with only cancer patients, hospice now provides services that offer comfort and reduce the suffering of any patient battling a disease or condition that can no longer be treated.
We provide care wherever the patient calls home, whether it is their own home, whether it's a hospital, whether it's a skilled nursing facility, or whether it's an assisted living facility. We take care of patients that range in age from 18 to greater than 100. And then our goal with providing hospice care is to provide care to meet the needs that increase the quality of life that enables the patient to live life to the fullest. There is a difference between palliative care and hospice care. Palliative care is care that is utilized to manage pain and symptom control, and hospice provides palliative care in that we take care of pain and symptom management, but we provide that to patients that have less than 6 months to live.
In the 30 years since the inception of hospice in America, healthcare has changed drastically. Many diseases that were acutely life-threatening have shifted into chronic illness, which require different models of care. Established in 1998, IntegraCare Hospice and Home Healthcare is a full-service home health, hospice, and personal care agency committed to maintaining the quality of life and dignity for its patients by providing exceptional physical, spiritual, and emotional care to both patients and their families.
The philosophy of care for IntegraCare Hospice and Home Health Care is to provide a full continuum. It allows us to really identify what the patient's specific needs are and have them in the appropriate care setting. It could be home care for part-time intermittent care, but as well as it could be for hospice care for end-of-life treatment. It allows us to really focus on what the patient's specific needs are.
With over 30 locations in Texas, IntegraCare Hospice and Home Health Care is a home-based program designed to provide support and care of persons in the last phases of incurable disease, so they might live as fully and as comfortably as possible. By working with a patient's attending physician and family caregivers, a customized plan of care is developed to address the needs of the patient and family.
At IntegraCare, we believe in putting our patient first in everything that we do, and by focusing our care and our efforts on the patient and their caregivers, we are able to identify their unique needs and customize a plan of care that enables us to meet those needs. We have a full menu of services that we provide to our patients and their caregivers. We have nursing services, social work services, chaplain services, aid services. We have a volunteer program, and we have a bereavement program. We can also provide physical therapy, occupational therapy, speech therapy, and then we also provide medical equipment, pharmacy services, medical supplies, everything that's related to the terminal diagnosis. We believe that we maximize a patient's quality of life by assessing their physical, spiritual, and emotional needs. And when we were able to do that and meet those needs, that allows for the patient to go about the business of living as opposed to working through the process of dying. Hospice services are paid for primarily through Medicare or Medicaid. There are some private insurance companies that have a hospice built-in benefit.
The cultural changes brought on in part by hospice have encouraged Americans to face end-of-life issues more openly. More and more families are now offered much-needed support while addressing the human struggles and medical issues related to a life-threatening illness.
10 years ago, my dad was diagnosed with prostate cancer. 2 years ago, it started spreading to, the bones in his body. And the last few months of his life, we decided that he would benefit from hospice care. It made a huge difference. We didn't have to worry about taking him to the doctor. Everything was brought to the house, everything that he could possibly need, from shower chair to wheelchair to all of his medication. Everything was brought to him. And he loved seeing the nurses come. He just fell in love with them, and they just brightened his day. I would rate the level of care from IntegraCare Hospice as from 1 to 10, a 10, definitely. They were great, and the care couldn't have been any better.
We hear things like, we couldn't have made this journey without you, you're our hospice angels, we don't know where we would have been without you, and so it's very, very positive in the feedback that we receive.
IntegraCare Hospice was there for my dad and for all of us. They made it very clear from the beginning that they were there to support all of us, and he got to be comfortable in his own bed, and they came in and taught us how to take care of him. And so he got to be, surrounded by his family, the moment he died. We were all in there with him, and that was real important that he got to be at home and surrounded by the people he loved. We would definitely recommend IntegraCare Hospice to others. They just make a huge difference in the quality of care at the end of life.
We started off as a small agency with a couple of locations and a handful of patients. And we made the commitment at the time to make sure that we kept the patient at the center of our focus. We never lost sight of quality in what we did. We're real proud of the fact that we've been able to expand all over Texas to multiple locations, taking care of small rural communities as well as large urban communities, but also making sure that we're small enough in nature to be able to still keep the patient at the center of our focus.
There is a distinct advantage to coming on hospice earlier in the dying process as opposed to later. It allows us to meet the physical needs of the patient. It also is going to provide less stress and in some cases less financial burden to the family.
We're very excited about the future of IntegraCare with regards to home care and hospice. The benefit is something that is gaining more and more popularity. Patients are accessing the care more often, and we feel like there's great opportunities for us to expand into new markets, to also continue to deploy technology in ways that we can improve the quality of care and quality of life for our patients, and for us to be able to serve a greater number of patients.
Anyone that's interested in hospice services can contact our office and let us know that they want a loved one or themselves to come on service, and we can start that process. We can contact the physician, or they can contact their physician directly, and we can work the process through that way.
We are there to take care of you. Hospice care is not about dying, it is about living and getting the most out of life at the most difficult time in your life. We're there to make sure that you know that you matter, your family matters, and we're going to be there to take care of you.
When time is short and medical science has no more to offer, hospice is a family affair that offers the promise of comfort. Learn more about IntegraCare Hospice and Home Health Care, committed to changing the way dying people in Texas are cared for forever. For more information, go to IntegraCareHH.com or call the number on your screen.